I am Antonio Fernandez, and I'm here presenting the participation of the CoronaSurveys team in the COVID-19 Symptoms Data Challenge, phase 2. What I'm presenting is work that has been done by the CoronaSurveys team. This team actually has been working since March in a bigger project in which we've been tracking the pandemic with essentially two techniques. One is using the official data on cases and fatalities and using a case fatality ratio, which is a classical index when measuring the impact of a pandemic, trying to estimate the parameters of the pandemic. And another technique we're using is using a survey with indirect reporting, obtaining the data about the pandemic. In this particular challenge, what we have done is we have validated the challenge data with some ground truth or golden reference that was provided by a serology study in Spain. Then we have integrated the challenge data with our own data obtained using the above two techniques that I mentioned in order to create a large repository that we have later used in order to do forecasting. So we came out with our own forecasting approach that uses this big repository to attempt to do forecasting for multiple countries. In particular, we try with a number of deaths, a number of new cases, but it could be used for any other target signal. Finally, we also looked at how the symptom survey, from where this data has been obtained, could be improved by using techniques from the CoronaSurveys project. The experience that we have had in that project maybe could be translated into ways to improve the survey that is being deployed in the COVID-19 symptom survey. So which are the techniques that we use? The first one uses, as I said, the official data on cases and fatalities, and it computes the ratio between these fatalities and cases, correcting by the fact that on a given date, the number of cases that are available may in fact include some that may become fatalities in the future. Using that, we get a corrected case fatality ratio that then we compare with a golden, assumed to be correct, CFR, case fatality ratio, and that will give us a correcting factor or a scale that we can use to correct the official number of cases. So in particular, I'm showing what has been obtained by correcting the dashed line in Brazil and Spain and applying this correction factor to obtain the solid lines that are estimators of what is the cumulative percentage of the population in both countries that have been infected of COVID-19. The second technique we use is we ask for indirect reporting of cases, fatalities, and other parameters. Essentially, we ask people to tell us, how many people they know of which they are aware of their health, and then out of those, how many have a given peculiarity, like how many had COVID-19, how many have COVID-19 right now, or attributes like that. And then we estimate the population, the incidence in the population of that particular aspect by just dividing the sum of one parameter by the sum of the other. So for instance, if we want to estimate the number of people with this blue circle around on the population on the right, which we have estimated, we have actually counted to be 23.5%, one thing that we could do, and this is typically what direct surveys do, we could ask people randomly. So we ask 3 random people, and we find out that these three random people, 2 of them have the property, and then we can provide an estimate of 66.7% of the population being circled by a blue circle. However, if instead of asking them okay, are you surrounded by a circle, by a blue circle? If we ask them, how many people do you know, including yourself, that are surrounded by a blue circle, then we will get many more answers, answers covering many more people, and the estimates that we will get would be 25%, which is much closer to the ground truth. So this has been done in the CoronaSurveys project. This is applied in the CoronaSurveys project by asking similar questions. So what I have now on the screen is a snapshot of the survey that we're asking. So the question in the center is exactly how many people do you know whose health you're aware of, and the third one is one of the questions in where particular an aspect of pandemic peculiarity. In this particular case, we're asking for the cumulative number of cases. So we're asking how many of the people you know have had COVID-19 or had the symptoms of COVID-19. We validated our results with a serology study in Spain. Since we estimate the cumulative incidence, we can directly compare this cumulative incidence with the percentage of the population that show antibodies of the COVID-19 or the coronavirus. As you see in the plot, the blue dots, which are the corrected CCFR estimates, and the red dots, which are the indirect survey estimates, both of them are highly correlated with the diagonal, or they are very close to the diagonal, which is the ground truth obtained with this serology study. In fact, the correlation coefficient is close to 0.9 in both cases, which tells us that seems like our method is solid. We still need to do more testing, but it's solid enough. We have used also results from the same serology study to validate the data provided to us by the challenge. Unfortunately, there's no cumulative data in the challenge data. However, within the serology study, it is collected the answer to certain questions that allow to estimate the fraction of the population that at a given point in time, in particular the point in time in which they filled the survey, had symptoms of COVID-19. This was taken over a period of 5 weeks, and for every region of Spain. So overall, we had 68 different values that we could compare with the signals that are provided from the challenge, in the challenge data. So in total, we used 219 signals, and we saw that some of them actually have a very high correlation, very strong correlation with the reference ground truth that we use from the NCOV data. In particular, on the right, you can see in green the signals that have the largest correlation. It is interesting that the top 4 signals actually are behavioral. So they are probably not showing the cause of the number of symptoms, of the cause of anybody being sick. They're more showing a correlation between the public measures that we're taking. So in particular, they show behavioral in terms of not going in public or not having contact with other people. However, it's interesting that the last 2 ones shown, community sick and headache, show, the first one shows how many, the percentage of people, or actually the percentage of people who answer that they know others who are sick, and the headache shows the percentage of people that were saying that they had headaches. So that means that there are symptomatic signals that in fact carry information about that can be used to obtain estimates. By applying, essentially we can also scale the values that we obtain from the data we obtain from the challenge. Each signal can be scaled in order to have an average value similar to the one we obtained in a COVID study. And after that, we observed that there are a few of them who have really small error, like, again, wearing masks or or not going in public have small errors. But interesting, we find that some symptomatic attributes also give nice. They are close to the actual pattern or the actual collection of values that the NCOVID signal is providing. So in fact, this shows that challenge data can in fact, probably after correction, can in fact be used to study what is the behavior of the pandemic. In particular, we did that in Spain and Brazil, and the 3 lines on top, the green, red, and black, are obtained with 3 different signals, all of them corrected from using the NCOVID factor, and the 3 of them show a very regular pattern. They have the same shape and similar magnitude. You can compare them with the ones at the bottom, which are the official numbers, and the CCFR, which are probably underreporting. Then we have integrated all these data, all these signals, the ones from the original challenge data, with the CoronaSurveys data, and we obtain unofficial data from the European Center for Disease Control, to create a large repository for more than 100 countries. And the idea is that this repository can be used as the input for a forecasting approach, which in fact we developed. So we developed a forecasting approach that takes this large repository and tries to estimate what is the, in this particular case, the number of fatalities that are going to happen in the future, in particular in Portugal. So to do this forecasting approach, takes every signal that we have as input, that we have in the repository, tries to find whether that signal has predictive power after shifting it. And then so that means we find an optimal lag, how much we can shift, or we should shift the signal into the future to get the maximum correlation with the target data that we want to obtain. And then once we have that, we can try to train a generalized linear model that tells us how to, which signals are the most important and how to combine them. So what I'm showing there is the red data is the official data with which we train. The black data, the black points, or the black line, is the official data that we use for testing. And the blue line is the one that shows for the fraction of values that overlap the red data is the fit of the model. And after that, what we're showing is the value of the prediction. We have tested this approach using a metric, which is the absolute standard error. And we see that over several weeks, actually over a month and a half, the estimates are not too far from the real data. And in fact, when we obtain the scale absolute error, the error we obtain with respect to a very, very simple Stroman model is reasonably good. But more experiences, more evaluation has to be done here. As I said, we believe that we can also improve, or at least propose ways to improve the challenge data. This indirect reporting that we use in the CoronaSurveys project is very powerful because it allows, with very few responses to the survey, to have information of many people, as we presented. So there is one signal in the CMU US data that had that feature. We tried to use it. Unfortunately, the problem is that the data that we had seemed to have a lot of outliers, and it was very hard to extract useful data because the data was already aggregated. However, we believe that this is a good way to get more coverage, which is using indirect reporting. And I think, or we think, we should ask for cumulative cases in the COVID-19 survey as well, because that would allow to validate the results with serology studies which provide cumulative data. They find or they obtain what is the percentage of the population that show antibodies. In conclusion, we have validated the both CoronaSurveys data, but also the challenge data using the nCovid serology study and survey. Then we have created a large repository that combines data from multiple sources, including the challenge and the CoronaSurveys. Then we have proposed a forecasting approach that we have run on different targets and countries. We evaluated it and obtained that the signals that they use are actually coming from different data sets. And finally, we proposed ways to improve the COVID-19 symptom survey with questions that either that obtain cumulative values and use indirect reporting. And with this, I conclude my presentation. Thank you.